Last week, Margaret, a 68-year-old grandma from Ohio, woke up, looked in the mirror, and noticed her eyes were puffier than usual. She laughed it off, told herself it was just bad sleep. But here's the painful truth. A month later, her doctor told her that puffiness wasn't from lack of sleep at all. It was her kidneys leaking protein. And she's not alone. Every day, thousands of seniors wake up, see changes on their face, swelling, rashes, even strange breath smells, and dismiss them as aging. But here's the kicker. Those little changes can be your kidneys' only cry for help before they fail. Ignore them, and dialysis or even kidney failure could be around the corner. The good news? If you know what to look for, your face can warn you early, long before blood tests or ER visits. And today, I'm going to show you the 7 signs you should never ignore. Most people think kidney problems only show up in blood tests, or maybe when the doctor tells you your creatinine is climbing. But the truth is, your body whispers long before that, especially on your face. The National Kidney Foundation calls kidney disease a silent killer because it rarely shouts. But if you know where to look, the warning signs are right there, in the mirror, every morning. The Mayo Clinic lists swelling around the eyes, dry, itchy skin, and unexplained facial puffiness as some of the earliest clues that your kidneys are under stress. The American Academy of Dermatology confirms that unexplained rashes and skin changes can often be traced back to poor kidney function. And even something as subtle as the smell of your breath has been linked to kidney failure by the Cleveland Clinic. But here's the part no one tells you. Most seniors dismiss these changes as just aging, and by the time they take it seriously, their kidneys have already lost half their strength. So in this video, I'm going to walk you through 7 facial warning signs, each one backed by trusted medical sources. For each sign, I'll share what it means and why spotting it early could save you from years of dialysis. And stick around until the very end, because the last sign, the one hiding right under your nose, is the one that shocks almost every patient I've met. All right, let's get started. The very first warning sign shows up quietly in the morning, and most people blame it on lack of sleep. But in reality, it could be the earliest clue that your kidneys are leaking vital protein. Sign 1. Puffy eyes or swollen eyelids. Imagine this. You wake up, shuffle to the bathroom, glance in the mirror, and your eyes look swollen, heavy, like you've been crying all night. Most people shrug it off, just didn't sleep well, and move on. That's exactly what happened to George, 72, from Florida. For months, he noticed his eyelids looked puffier in the mornings. He blamed it on his age, maybe salt from last night's dinner. But when his daughter finally convinced him to get checked, the blood test showed something far more serious. Protein was leaking into his urine, an early sign of chronic kidney disease. And George's story is not unique. The National Kidney Foundation warns that puffiness around the eyes can be an early sign of protein in the urine, a signal that the kidney's filters may be damaged. Why the eyes? Because the skin around your eyes is thin and delicate, making swelling easier to notice there first. When your kidneys can't keep protein where it belongs, in your blood, it spills into the urine. Over time, this loss of protein makes fluid shift into tissues, and the first place you'll see it is in the mirror, staring back at you. The Mayo Clinic also lists swelling around the eyes as one of the most common early symptoms of kidney problems. Doctors call this periorbital edema, but in plain English, it's just fluid building up where it shouldn't. Now here's the kicker. This swelling often appears long before other symptoms like fatigue or back pain. That means if you catch it early, you may have a window to slow kidney damage. And don't confuse it with just eating too much salt or staying up too late. If you notice your eyes look puffy every morning, especially if it doesn't go away after rest, your kidneys might be the ones crying for help. Because think about it, your eyes aren't just tired, They might be showing you what your blood tests haven't caught yet. And if you think puffy eyes are concerning, wait until you see the next sign. It's not about swelling, but about the way your skin feels every single day. Sign 2. Facial swelling. Let me tell you about Linda, 66, from Arizona. Every morning she'd joke with her husband that her face looked puffier than his. She thought it was just age, maybe a little too much bread and pasta. But the puffiness got worse. Her cheeks felt heavy, her jawline disappeared, and soon her friends started asking if she had gained weight. But here's the painful twist. Linda hadn't gained a single pound. What she was really seeing was edema, swelling caused by her kidneys struggling to filter fluid. According to the Mayo Clinic, when kidneys start to fail, fluid can build up in the body, causing swelling in the face, hands, feet, and ankles. The medical term is edema, but to Linda, it just felt like she was looking at a stranger in the mirror. Why does this happen? When healthy, your kidneys act like sponges, balancing fluid and salt. But when they're weak, sodium and water escape into tissues instead of being removed in urine. The result? Your face looks bloated, your eyelids puff, and your cheeks can swell as if overnight. The National Kidney Foundation explains it simply. Swelling, especially in areas like the face and ankles, is often a red flag that the kidneys aren't removing excess fluid and salt properly. Now, here's where it gets tricky. Facial swelling can easily be mistaken for other things: allergies, sinus issues, even eating salty takeout the night before. But unlike those, kidney-related swelling doesn't just disappear with a nap or a glass of water. It lingers, it worsens, and it often comes with swelling in your hands or feet. And here's the kicker. Some people don't notice until they see old photos. They realize their face used to look sharp, but now it looks rounder, not from weight gain, but from hidden kidney trouble. Think about this. Your face is the most visible part of your body. If fluid is building up there, imagine what's happening inside, around your heart, your lungs, your blood vessels. This isn't just about appearance, it's about survival. Linda learned that lesson the hard way. By the time she took her facial swelling seriously, her kidneys had already lost nearly 60% of their filtering capacity. The only good news? Catching it then gave her a chance to change her diet, lower her salt intake, and slow the decline. So, if you wake up day after day with a swollen face that just won't go away, don't write it off as aging. Your kidneys might be screaming louder than you think. And if swelling shocked you, wait until you hear about the next warning sign. It's not about how your face looks, but how it feels. That constant dryness and itch that no lotion can fix. Sign 3. Dry, itchy skin. Have you ever reached for your favorite face cream, applied it twice, maybe 3 times a day, and still felt like your skin was desert dry? That was Helen's reality. 71 years old, retired teacher from Texas. She kept blaming the Arizona climate, even bought the most expensive moisturizers at the drugstore. But no matter what she tried, her cheeks stayed dry, itchy, and flaky. At night, the itch got so bad, it even woke her from sleep. Finally, her dermatologist ran blood tests and gave her news she never expected. Her dry skin wasn't just cosmetic. It was her kidneys struggling. The Mayo Clinic lists dry and itchy skin as one of the common symptoms of chronic kidney disease, especially as it progresses. And the American Academy of Dermatology, AAD, explains why. When your kidneys don't work well, waste products like phosphorus build up in your blood. That buildup irritates your skin, leaving it parched and itchy. Here's a simple way to picture it. Healthy kidneys are like a water filter under your sink, flushing out the impurities. But when the filter is clogged, toxins sneak back into your bloodstream, and one of the first places you feel it is on your skin. And here's the scary part. Most people keep scratching, keep buying new lotions, but the problem isn't on the surface. It's deep inside. Now, skin changes can be subtle. You might notice fine flakes around your nose, patches of redness on your cheeks, or an itch that won't quit even after moisturizing. Unlike normal dry skin from cold weather, kidney-related dryness tends to be persistent and widespread. The National Kidney Foundation notes that skin problems are common in people with kidney disease, including dryness, itching, and color changes. And unlike simple eczema, this dryness is tied to your blood chemistry. Too much phosphorus, too little balance. Helen's turning point came when her daughter asked, "Mom, why are you scratching all the time?" That small question led to a doctor's visit, which revealed stage 3 chronic kidney disease. It was a shock, but also a blessing. Because she caught it before dialysis, Helen was able to adjust her diet, lower her phosphorus intake, and get treatment that eased her skin and protected her kidneys. So, if your skin feels like sandpaper no matter how many lotions you try, it might not be your age or the weather. It could be your kidneys begging for attention. And speaking of skin, dryness is just the beginning. The next sign isn't about texture, it's about color. If your skin looks paler than usual, your kidneys might be stealing the very thing that keeps your face alive. Sign 4, pale skin. Have you ever had a friend say to you, "Are you feeling okay? You look a little pale," and you brush it off, thinking maybe it's just the lighting or you're tired? That's exactly what happened to Robert, a 70-year-old carpenter from Michigan. His wife kept noticing his face looked washed out, almost gray, even though he was eating fine. He laughed it off. "Guess I'm just losing my tan." But the truth was far more serious. Robert's kidneys had stopped producing enough of a vital hormone called erythropoietin, and his body was sliding into anemia. The National Institutes of Health, NIH, explains that the kidneys normally release erythropoietin, EPO, a hormone that tells your bone marrow to make red blood cells. When the kidneys weaken, they don't make enough EPO, which means fewer red blood cells and less oxygen reaching your tissues. The result? Your skin looks pale, your lips lose their color, and you feel exhausted. The Mayo Clinic also lists anemia as one of the common complications of chronic kidney disease, leading to skin pallor, weakness, and fatigue. It's not just a cosmetic issue, it's your body telling you it's running low on oxygen. Think about this. Your skin is like a window. If it looks pale on the outside, it means your blood is struggling on the inside. Robert's story is a painful reminder. By the time he went to the doctor, his hemoglobin had dropped below 10, far lower than normal. That's why he was constantly tired, even after a full night's sleep. But here's the hopeful part. Once he started EPO treatment and iron supplements, not only did his energy return, but the color in his face slowly came back too. So, how can you tell if your paleness is just from staying indoors or something more? If your lips and inner eyelids, the conjunctiva, look pale or whitish, that's a red flag. If you feel tired, weak, or short of breath, along with pale skin, that's another sign it's not just aging. The Cleveland Clinic notes that anemia from CKD is one of the most overlooked symptoms because many seniors blame fatigue and pale skin on just getting older. But in reality, it's a treatable warning sign if caught early. So next time someone tells you that you look pale, don't just laugh it off. Your face might be showing the oxygen shortage your blood tests haven't revealed yet. And if pale skin wasn't surprising enough, wait until you hear about the next one. It's not about losing color, it's about gaining the wrong color, a yellow, muddy complexion that could mean toxins are quietly building up inside you. Sign 5, yellow or sallow skin. Sometimes the mirror doesn't lie. You wash your face, look closer, and realize your skin looks different. Not pale, not just tired, but yellow, muddy, almost sallow. That was the case for Patricia, a 64-year-old retired nurse from California. She first noticed her coworkers telling her, "You look a little jaundiced. Are you sure your liver's okay?" But when she finally saw her doctor, the surprise was shocking. Her liver was fine. It was her kidneys that were failing. The Cleveland Clinic explains that when kidneys can't filter waste properly, toxins like urea and other nitrogenous wastes build up in the blood. This condition, called uremia, can change the color of your skin, giving it a yellowish or grayish tint. In severe cases, doctors even describe something called uremic frost, where urea crystals literally deposit on the skin surface. But long before it gets that bad, many patients notice their skin losing its healthy tone, becoming muddy or yellow. And here's the kicker. Most people blame it on aging, sun damage, or even poor diet. But in reality, your kidneys may be painting your face with toxins. Patricia remembered trying new foundations and face creams, thinking she just needed better skin care, but no cream could hide the fact that her kidneys were struggling to clear waste from her blood. When she finally got tested, her GFR, glomerular filtration rate, had dropped to 25, a clear sign of stage 4 kidney disease. The Mayo Clinic and National Kidney Foundation both emphasize that skin color changes, yellow, brown, or gray tones, can be linked to toxin buildup in CKD. These changes are not cosmetic, they are biochemical warning signs. So how can you tell if this is happening to you? Look at your skin tone in natural light. Does it seem muddy or yellow even after good sleep? Are friends or family asking if you're sick even when you feel fine? Do you also notice other CKD signs like itching, swelling, or metallic breath? If the answer is yes, it's time to take it seriously, because once toxins show up on your skin, they're already circulating throughout your body. Patricia's turning point came when she realized makeup couldn't cover the problem, but by changing her diet, lowering her protein intake, and working closely with her nephrologist, she delayed dialysis by over 2 years and slowly regained a healthier complexion. So if your face looks yellow or muddy, don't just blame the lighting. It could be your body's way of saying, "I'm drowning in toxins, help me." And if skin color shocked you, wait until you hear about the next warning sign. This one shows up not as a tint, but as tiny red bumps and rashes that itch and spread, even when your dermatologist can't explain why. Sign 6, rash or acne-like. Bumps. Picture this. You wake up, glance in the mirror, and see small red bumps scattered across your cheeks. Maybe they itch, maybe they burn. You think, it's probably an allergy. Maybe new laundry soap or that cream I tried last week. That's exactly what Sandra, 69, from New Jersey thought. She spent months trying to treat what she believed was adult acne. She switched face washes, cut out dairy, even changed her pillowcases daily. Nothing worked. The rashes kept coming back, and sometimes got worse. Finally, a dermatologist did something Sandra hadn't expected. Instead of giving her another cream, he ordered blood tests. The results? Sandra's rashes weren't skin deep. They were signs of uremia, toxins building up because her kidneys weren't filtering properly. The American Academy of Dermatology, AAD, confirms this connection. People with chronic kidney disease often develop skin changes, including rashes, bumps, and persistent itching. When the kidneys fail to clear waste products like urea and phosphorus, they circulate in the blood and irritate the skin from the inside out. The National Kidney Foundation also notes that skin problems are common in kidney disease, including itching, rashes, and changes in skin appearance. Unlike a simple allergic rash, these eruptions don't always respond to topical creams because the cause is internal, not external. And here's what makes it worse. Most seniors spend months chasing creams and lotions, while the real problem, kidney damage, goes untreated. Sandra's rash was the clue that finally got her the right diagnosis, stage 3, chronic kidney disease. Looking back, she realized the itching had started long before the visible bumps appeared. That's something doctors emphasize. CKD rashes often start with intense itching, followed by redness, bumps, or even lesions if the skin is scratched too much. The Cleveland Clinic explains that in advanced cases, patients may even develop calciphylaxis, calcium deposits in the skin that cause painful ulcers. Thankfully, Sandra wasn't that far along, but her rash was the loud alarm her kidneys were ringing. Here's how you can tell if a rash might be kidney-related. It appears without a clear trigger, no new foods, soaps, or medicines. It persists for weeks or months, even after using standard creams. It comes with other CKD symptoms, fatigue, swelling, or changes in urine. Sandra's story had a silver lining. Once she adjusted her diet, reduced phosphorus intake, and worked with her nephrologist, not only did her blood tests improve, but her rashes slowly faded. So, if you keep battling rashes that refuse to heal, don't just blame your soap or skincare. It might be your kidneys crying out through your skin. And if skin rashes weren't unsettling enough, let's move to the final, and perhaps the most shocking sign. This one doesn't show up in your skin at all. It shows up in your breath, and it's something your loved ones may notice before you do. Sign 7. Metallic or ammonia. Breath. Some warning signs you can see, others you can smell. For Frank, 74, from Illinois, it started subtly. His wife noticed that his breath sometimes carried a strange odor, not garlic, not coffee, but something sharper, almost chemical. At first, she thought it was bad dental hygiene. Frank brushed more, used mouthwash, even bought a fancy tongue scraper. Nothing worked. Finally, during a routine checkup, his doctor asked if anyone had mentioned a metallic or ammonia-like smell in his breath. Frank's wife nodded immediately. That's when the doctor explained, this wasn't about his teeth, it was about his kidneys. The Cleveland Clinic confirms that in advanced kidney disease, waste products like urea build up in the blood. When this urea breaks down in saliva, it produces a distinct odor, often described as metallic, fishy, or like ammonia. Doctors call it uremic fetor, and it's one of the most telling signs of serious kidney trouble. The National Kidney Foundation also notes that bad breath and a metallic taste in the mouth can occur when waste products build up in the blood due to kidney failure. Here's the kicker. Many patients don't notice it themselves. It's their spouse, their children, or even a friend who points it out, often awkwardly. Think about how powerful that is. Your breath becomes a messenger for your kidneys. When they fail to filter toxins, your body tries to expel them in any way it can, even through your lungs. That's why the odor is often strongest in the morning or after protein-heavy meals. Frank admitted he also had a persistent metallic taste in his mouth, like he had coins under his tongue. That's another hallmark of uremia. And once his blood tests came back, the truth was undeniable. His creatinine was over 5, and his GFR had dropped below 20. He was already in stage 4 kidney disease. But here's the hopeful twist. Catching this sign meant he finally took action. By working with his nephrologist, adjusting his diet, and starting medications, Frank delayed dialysis and regained some energy. His wife also said his breath improved once his blood chemistry was better controlled. So, how do you know if your breath is a red flag? If brushing, flossing, and rinsing don't fix it. If others describe it as metallic or ammonia-like. If it comes with fatigue, swelling, or changes in urination. So, if your loved ones mention a strange smell in your breath, don't just grab another mint. Listen, because your kidneys may be sending their most urgent warning yet. And now that you've seen all 7 warning signs, from puffy eyes and facial swelling to rashes and even ammonia breath, the question is, what will you do with this knowledge? Because ignoring them could cost you your freedom, but catching even one early could save your kidneys. We've covered a lot today, and maybe you even recognized yourself in one of these stories. Let's take a moment to recap the 7 facial warning signs of kidney trouble. 1. Puffy eyes in the morning, one of the earliest clues of protein leaking from your kidneys. 2. Facial swelling, not weight gain, but fluid your kidneys can't remove. 3. Dry, itchy skin, toxins like phosphorus irritating your body from the inside. 4. Pale skin, anemia from your kidneys no longer making enough red blood cells. 5. Yellow or sallow complexion, waste building up in your bloodstream. 6. Rashes or red bumps, uremic toxins showing up on your skin. 7. Metallic or ammonia breath, your lungs trying to expel what your kidneys can't. These aren't random cosmetic issues. They're warnings backed by Mayo Clinic, the National Kidney Foundation, the Cleveland Clinic, the NIH, and the American Academy of Dermatology. And here's the truth most people miss. Your face is more honest than your blood tests. By the time lab numbers rise, your kidneys may already be half gone. But your mirror, it's talking to you every single day. If you catch even one of these signs early, you may buy yourself years of freedom. Freedom from dialysis, freedom from endless doctor visits, freedom to enjoy your life. But if you ignore them, brushing off puffiness or rashes as just aging, you could be walking straight into kidney failure without realizing it. Your face isn't just a reflection, it's your body's first emergency signal. Don't ignore it. Your face is more than skin deep. It's your kidneys begging you to listen. If you found even one of these signs surprising, do me a favor. Hit that subscribe button. It helps more seniors just like you spot the danger before it's too late. Drop a comment below. Which of these 7 signs shocked you the most? I read everyone. Save this video, so the next time you look in the mirror, you'll know what to watch for. And please, share this with a friend or family member. Puffy eyes or rashes might look harmless, but you now know the truth. They can be life-saving clues. And if you're ready to go deeper, don't miss my next video. It could change the way you eat tomorrow.